All right, so today we're real fortunate to have Dr. Greg Byrne here with us. You guys have heard me talk a little bit about like the things that I do to keep our horses looking good, and you know, I think that's all fine and dandy, but I think it comes a lot better from a professional. Greg, we've had a lot of people asking about just basic stuff like care, how we get them looking the way we do. I mean, I know we've got a performance barn here, so we take things to the next level. But like Apache here, can you just tell us a little bit about like the shoeing and vaccination, stuff like that you know we take for granted, but I think a lot of people would love to hear.
Okay. Yeah, what we try to do is kind of keep things simple, and we think of kind of I think of in a rule of six, like sixes. So I think the shoeing, we like to do the shoeing every 6 weeks because the hoof capsule is changing. We can notice changes to the conformation of the hoof, and we can adjust it quicker if we are on a 6-week schedule. We like to do our vaccines typically on a 6-month schedule. We typically have gone to using the core vaccine now, which has the 5-way, the tetanus, the rabies, and the West Nile all in one vaccine, and we couple that with an influenza rhino vaccine. We typically do that every 6 months, and the caveat that being we split that 6 months and do flu rhino boosters to horses that are going to leave for competition, because the duration of immunity on those vaccines are usually about 3 to 4 months. The other thing we do is dentistry. They work on a lot of young horses here, and they train in school and show, and their mouth is continually in a state of flux because they're getting new teeth, losing teeth, getting caps, and their teeth are softer when they're younger, so they need more dentition care. So we're typically floating those teeth every 6 months, putting bit seats in them, making sure that we remove the caps that are coming out, keep everything smooth.
Yeah, the teeth is a big deal, especially in the 2-year-olds. It's one of those things that I tend to kind of forget about. 2-year-old time, though, I really don't, because you'll have those days they're going really good, and you're just getting them started, and you're teaching them to put the snap on their mouth.
Right.
And I know that's when I call, because I'm like, man, this horse is like, usually it doesn't take long. You figure out, you're like, what's going on? I'm not really pulling that hard. And they're overreacting,
right.
And 9 times out of 10 you come out and you're like, they got some wolf teeth
right.
in there. One other thing that comes up all the time is the horses getting ulcers. You know, I get comments or people with questions, and they're training related, or they think it is about, right. You know, a horse that, and I always hear the horse was fine, nothing changed, and then all of a sudden they get irritable, they don't want to stand still, things like that. Can you talk about like a little of, you know, what you use to treat them, what are the signs? Because it's been in my experience now dealing with, you know, having you know, you come out, and just over my career, if I think that something's changing with their attitude, most of the time ulcers play a factor, and treating them doesn't hurt anything.
Right.
But what do you think?
That's correct. And basically the signs from gastric ulcers in horses can be anything from just limited performance to outright colic. I've had horses that have looked like they were surgical colic cases because they're that painful, that had GI ulcers, but I've also had horses that basically were tough but just weren't performing at the level that it should be. There's several classes of drugs that we use to treat them with. Medications, we use omeprazole, which is like Gastrogard or Ulcigard, which is a protein. It helps shut down the protein pump, which produces the hydrochloric acid in our stomach. Some of the older medications are like cimetidine or ranitidine, which are basically H2 agonists, which block those receptors in the stomach. And a lot of times we'll use sucralfate, which is a kind of a GI coatant, which protects them. So there are a couple ways that you can go about it, and by treating different mechanisms at the same time, effectively you get a resolution of the clinical signs quicker, I find.
See, and I think to me, like when we need to use our vets more. You know, I mean, for sure, if you ask them, you know, and I think that's the biggest thing is you got to ask, you know, like say, hey, you know, what do you think of my horse's overall look? And then you got to, you know, sometimes you probably got to ask for the simple version, because those guys have all the medical terms, and I'm sitting there going, I have no idea what you're saying. What should I do? And usually, though, if you do that, they got to answer for you. Like, you know, that's a great thing. Dr. Byrne going to a lot of competitions, treating horses going to competitions. He knows what we're looking for. But at the end of the day, we all want the same thing, whether we're going to a competition or not.
Right.
We want our horse feeling as good as they can. And what I want you to start thinking about is not everything's a training-related issue. Always think about that horse's health first, number one. And that's where, you know, getting a vet involved early, I think, also save you some money, too. Don't wait until you've got some major catastrophe. Wouldn't you agree? I mean,
yeah, I would agree. And I think that when veterinarians interact with owners and trainers, it also helps us from interact when we know where your level of familiarity with different things. Sometimes we assume you know things that we maybe
Exactly.
you don't.
Right.
So until you have that rapport where you kind of feel each other out and know where you're at, so you can be a team basically, and a team basically is a trainer, an owner, horse, and a farrier and veterinarian. And if you don't have strong pillars on all three levels of that stool, it's not going to be very stable.
Well, we could go on for hours and hours about care of the horse, and we'll try to bring some more to you. We just happened to grab Dr. Byrne. He came in and he was nice enough to talk with us for a little bit. I hope that guys helped. I hope that helps you some. You can send us comments and ask questions if you have.
Sure.
Your veterinarians in your area probably can answer some questions for you also. But just wanted to spend a little time just talking to you a little bit about just what I take for granted as routine care that some don't think about. So, Dr. Byrne, thank you so much.
You're welcome.
Appreciate it.
Are you looking to step your game up? Perfect. All you have to do is go to mattmillsramey.com. It's only $24.95 a month. Sign up today, because the key to success is knowing.